Dr. Gaab, welcome. Please proceed.
I'm Professor Nadine Gaab. I'm a dyslexia expert working at Boston Children's Hospital, Harvard Medical School, and the Harvard Graduate School of Education. I would like to talk today especially about early screening as well as what we should do in response to screening as outlined in this bill. Currently, we have a wait to fail approach in the United States, which means that children have to fail over a significant period of time before they get identified as having problems with reading. The problem is that what we call the dyslexia paradox is that the research has shown that the optimal window, or the most effective window for remediation or intervention of reading difficulties is in kindergarten or first grade. So we have this paradox where we don't really identify children until they fail over a very long time, but we are missing the window of the most effective intervention. Why is the window most effective when they're early on? The brain is much more plastic when it comes to language early on. We all know this, that it's harder to learn a second language later on, and they are just so much more behind. We also know from research that there's excellent screening tools out there. We know exactly which tools to use, when to use them. We can use them as early as preschool. We have developed some on an iPad. There's others out there. So it's really easy to administer. We know what to do, and we know also how to respond to screening and when this should be done optimally. That's as early as kindergarten and first grade. We can do this if we are not optimally responding to this. Screening is useless, and that's where it comes to teacher training. So teachers need to be trained in methods that are evidence-based, structured, explicit, and that are really focusing on the deficits the kids have as early as possible. I also would like to say that there are brain characteristics that many researchers around the world have identified of dyslexia, and we could show that these brain characteristics of dyslexia are already there when they step into their first day of kindergarten. So it's not that the brain changes because you're failing to learn to read. These kids are stepping into the first day of kindergarten with a less optimal brain to learn to read. So there's no reason to let them fail 2 years, 3 years, 5 years, 7 years. We should identify them as early as possible, preschool, kindergarten, first grade, and give them what they need in response to this so that we can have a support model and going from a deficit model to a preventive model.
Excellent. Are there any questions for these witnesses? Thank you very much, ladies.